Hi, my name is Tim Yao, social media editor for the American Journal of Kidney Disease and NephMadness contributor. NephMadness is going on live right now at AJKD blog, so head over there now to read up on the topics and put in your last-minute bracket before submissions close at midnight on March 24th. This morning I had the opportunity to sit down with Dr. Eleanor Lederer, president of the American Society of Nephrology, to discuss her selections. We will address some of those concepts in the interview to follow.
Okay, so we are so pleased to be joined via video conference by Dr. Eleanor Lederer from the University of Louisville, who's also the chief of the division there and the president of the American Society of Nephrology. So thank you for joining us for this interview.
Absolutely, I'm thrilled to death.
We're going to talk a little bit about your NephMadness picks, and I want to ask you first about the dialysis region. So for the dialysis region, you chose depression in dialysis as your winning concept. And one of the most striking things to me as I was reading that was how many of the symptoms overlap between the DSM-4 criteria for depression and symptoms of kidney failure, things like sleep changes, weight changes, fatigue, concentration deficits, and so forth. So it becomes very hard to identify depression in our dialysis patients, and I think we're probably underdiagnosing that. How do we go about improving that recognition when the waters are so muddied to begin with?
I think that we can probably work on the assumption that close to 100% of our patients are depressed, and then work backwards to figure out who actually is not depressed. Let's face it. Going to dialysis 3 times a week, spending 4 hours at a time, having all of the systemic issues that one has, plus, the hassles of getting in the way of your life, I would be actually shocked if I had patients who didn't say that at least at some time or other, they were not depressed. I think the question is not so much how do we identify depression or not identify depression. I think it's more a question of how we help our patients cope with it, because I think it's going to be there.
What in your mind are some potential strategies outside of pharmacologic intervention that we can do as clinicians to assist our patients who most certainly are depressed, like you say?
One of the things is to acknowledge to the patient, we know this is rough. We know that your life is not ideal. I mean, dialysis is a life-giving procedure, and they're all very grateful. Don't get me wrong. They're all very, very grateful for what they have. But I think the first thing is just to acknowledge, hey, things are rough for you. And to help them have more control over what happens to them, I think this is a big issue. I think the control issue is a big one. If you felt like you didn't have control over your day because you have to be here at this time for this long doing this is what you have to eat, this is what you have to take with it, this is other medications that you have to take, this is how much you can drink, that's a lot of loss of control. I think whatever we can do to give patients more control is going to help them tremendously.
Absolutely. Yeah, I think you hit the nail on the head. Just the acknowledgement and the empathy for that situation would really go a long way, because I think that's something that's lacking as you're just running through a dialysis unit seeing 25 patients.
And before we go any further, actually, I need to clarify one point. Okay, so you keep saying that this is my bracket, and I think it's important to point out that I have a team.
Oh,
I am just the coach. Okay, I am just the coach. I am just the coach, okay? So I have a team. Dr. Breyer is part of my team. Dr. Jacobs is part of my team. And then I have 4 residents who are also part of my team as well. I was not the person that was responsible for the final choices. I looked at them, of course. As a team, we worked together. We looked at all the plays. We reran the videos. We decided to try who was going to be the strongest lead in each category and worked on that basis. And I think you can't deny the absolute intellectuality of the team that I had. They were the best.
Well, I guess the results will tell us, right? I think you have a strong bracket personally. I think you have.
I think it's a very strong bracket. I'll be quite upfront and say I did not agree 100% with every choice that was made. But like I said, I'm the coach. I'm the coach. These guys, I can't play the game for them. They have to be the ones that play the game.
Gotcha. So, Coach, let me ask you then, what were your thoughts as you were going through, say, the diabetes region? You guys had the SGLT2 inhibitors kind of winning there. What's your take on that new class of agents as far as, well, obviously we've read things like the EMPA-REG data. What's your thought on using that class of agents for preventing heart outcomes in renal disease, albuminuria, GFR loss, and so forth?
I think it's extremely exciting. I think it's very, very exciting. Obviously, it has its limitations. This is not going to work in a dialysis patient, but for the early stages of diabetic disease and early stages even of diabetic kidney disease, I think this is very, very exciting foray. It's also kind of cool that this came from some very old and well-established basic science research, in looking at how glucose was transported in the proximal tubule, what regulated it, the proteins that were responsible for it. And, hats off to Ernie Wright. I mean, what a guy, after all those decades, to see the protein that he was championing actually come to fruition as a therapeutic drug, I think is absolutely fantastic.
And then I want to ask you about your champion. I don't want to dwell on it because Dr. Feldman talked a little bit about this as well, but PLA2R antibody testing in membranous. Tell me as a coach, did you agree with that as the champion?
Oh my God, yes. Okay. They got the hometown advantage here. Let's face it, it was at the University of Louisville proteomics laboratory run by Dr. John Klein, who is my close colleague. They are the ones that actually identified PLA2R as the target antigen for membranous nephropathy. And so how could we not put that as the winner?
So there's sentimental value too.
Okay, so there was a little bit of emotion involved in that one. Maybe that was not quite as specifically and clearly unemotionally, chosen. But let's face it, it does have the hometown advantage. It has the hometown advantage here. And we thought that, in terms of looking at a cause of a glomerulopathy, when up to this time we've done nothing but basically look at pathology, describe pathology, and say this is the disease. Now we have something that's a diagnostic tool, a potential target, and a causative agent.
Well, just like if you were to make March Madness picks, you want to choose the team that's going to win, but you also want to choose the team that you want to win because you actually want to root for your team, not just for your bracket. So I think that's kind of
Absolutely.
Yeah. So any last words for you before we wrap up this interview? Any shout outs you want to make, Dr. Lederer?
Let me just say, so this is the first year that I've participated in NephMadness. And I'll be quite honest with you, before this time, I just didn't get it. I didn't know why we were doing it. I didn't know how to play the game. I had a hard time figuring out, how do I decide between two things having to do with the same disorder? What are they actually looking for? But this year, after having played it, let me tell you what, now I'm going to start developing my team for next year. We're going to get on this early.
That is, as someone who has worked on this, extremely exciting to hear because that's exactly what we want people in academic institutions to be doing, is to be spreading this word, being a coach, like you say, to young people to get them interested in this. So I want to thank you for your time. A quick shout out for the very vibrant ASN communities. I really like the whiteboard in the back, the Louisville, Kentucky, Jason, and the kidney.
Absolutely.
Off into the brackets. That's genius. Thank you, Eleanor, for your time. Really appreciate it.
Absolutely, Tim. Good to talk to you.